I started to get these hives. It was mostly on my back, sometimes on my shoulder.
You're called about a patient who's, you're told, not able to swallow easily anymore. They're in extraordinary pain. To me, this is one of those incredible opportunities where you have a moment that is considered actually quite critical. As a diagnostician of dermatology, I specialize in decoding the mysteries of rare and complex skin conditions. A skin finding may actually be the sign of internal pathology. I'm here to reveal it as your Skintellagent.
Well, it kind of started August 2022. I went in for a thymoma removal and everything was great. Got released from the doctor at the end of October. Everything healed good. And then I started to get these hives. It was mostly on my back, sometimes on my shoulder, and sometimes on my lower back. And they were getting progressively worse, and went through the process of seeing the doctor every so many weeks, getting a whole bunch of different drugs and creams and bandages and, being wrapped like a mummy. Couldn't really do anything. They said, make sure you don't lay down. Well, I couldn't lay down anyway, so it was like you lay down and you kind of scream because your skin is separating, but you don't have no skin.
So to me, this is one of those incredible opportunities where you have a moment that is considered actually quite critical. You're called about a patient who's, you're told, not able to swallow easily anymore. They're in extraordinary pain. They have changes that are both happening on their skin and in their mouth and maybe even in their eyes. It's been progressive over the past couple of months and they don't have an answer. And you're given this opportunity to walk in and meet someone and maybe use your skill set in a way that could be life-changing. I remember very vividly walking in the room and meeting Judith, and really the striking presentation of both her skin findings and the oral mucosal findings. Obviously quite severe. This poor woman had been suffering for months, literally, trying everything she was told to do and yet getting worse and worse. And now here she is, admitted to the hospital because frankly she's unable to tolerate any oral intake. Liquids, foods, could barely speak. And yet, as much as I just wanted to throw the kitchen sink at her and fix her, my job is really to figure out not just how we're going to get her better, but why is this happening? If it's okay, I'd like to examine the mouth first. Okay. I'm going to use my fingers. Okay. So, do you feel like the blisters are getting a little bit worse? I don't believe that these were...
On my mouth, they fell off and then they seem to be coming back. But my tongue is the one that hurt. First there were small blisters just on my feet. And then my feet are all clear. And then it started to be bigger blisters all in the crevices of things. Under your arms, under the breasts, in the crotch. And then they just blew up. I mean, they were just huge.
The thymoma inside your chest that was removed back in August, and I know, looking at the notes, carefully dissected off of your heart and your aorta. Right. It was sitting right there. In a very important space. It was occupying a space that was fairly tenuous. My assessment is that this blistering rash is actually called paraneoplastic pemphigus.
It was hard. It was hard for my family. They would have been there all the time. My brother died in the middle of this, and so everybody was grieving. And I didn't have time to grieve because I didn't have any skin. And so I was more in pain than I was with anything else. So I cried a lot.
What was striking about her disease was not just the clinical presentation, but rather that small amount of medical history that had led up to her presenting in the hospital. The notable finding was that she had had this absolutely incredibly rare tumor called a thymoma sitting in her chest cavity. It was sitting on top of her heart and sort of abutting the aorta, the largest vessel that leaves our heart that serves our body with blood. And when I was reading through her history, the size of the thymoma when it was first identified was very, very small. And within 6 to 8 weeks, at the time point at which she was actually scheduled to go in for surgery, it had, quadrupled in size. She had that tumor, excised very precisely from her chest cavity. And my biggest concern was there a tiny, tiny portion of that tumor, meaning even microscopic, some residual cells that were not taken out with the tumor, that could still be there and pose a risk to her life, because the thymoma is a cancer, and thymomas are incredibly, incredibly rare, but they are one of the only 3 or 4 cancers that can lead to this autoimmune blistering disease. I'll say Judith was not a textbook case. This was not someone who, you made a diagnosis, you give her the medication, and all of a sudden everything drifts away. This was a very challenging disease burden to get under control. And I still think that probably is because she didn't have just this organic autoimmune disease we call pemphigus vulgaris, but she had it driven by the fuel in the thymoma.
I'm doing really good now. Haven't gotten any blisters or rashes or anything like that.
And how long has this process been?
2 years.
I can say, handily, I am incredibly grateful to be where we are with Judith right now. This has been a journey of tremendous patience for her. When it's harder on patients, it's also harder on me. You end up feeling with them as they go through this, and you want it to go away yesterday. But today we're here, and she's doing really, really well, and she can eat everything she wants to eat, and she's doing everything she needs to do to stay healthy. This has been not just a burden on her from the perspective of the skin health and the emotional health, but the medications that were required to get her under control, put weight on her, and she's, doing what she needs to do to stay healthy. She's, like I say, just an incredible human being.